Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Ryan Kelly, and he's the administrator of Rural Health Association of Arkansas. Ryan, thanks for being here.
Thanks, Robin. Appreciate it.
So we're talking about telehealth and changes that you anticipate to see, or how has telehealth evolved over the last few years?
Well, telehealth has really been around for decades. The military used to use it all the way back in World War II, believe it or not, for delivering very simple healthcare to soldiers. And of course, it's evolved so much since then. I mean, the internet, of course, is really the birth of what truly established telehealth as we see it now. And especially in the 90s, early 2000s has really been born. And now, of course, the COVID pandemic really skyrocketed telehealth into the forefront. It's been around, we've used it, and we've been encouraging it pre-COVID. But now, since the pandemic, it has really shot up and been used by both providers and patients in ways that we always dreamed, but we never thought we'd actually get to this quickly, meaning all providers in any setting can deliver it, patients in any setting, including their own homes or cars, can receive it, and is being reimbursed. And that's really the dream spot that we always wanted. And now is the dream of moving forward with all the different technologies and opportunities to really grow access. So it's fun to see, and it's grown a lot over the last several years, especially.
And there's a lot of benefits to it, not only for the patient, but for the healthcare provider.
Mm-hmm. Absolutely. So, I mean, one is just a modality. You know, we don't like to even think of telehealth and telemedicine as being different than in-person care. It's just a different modality. Like, do you take a plane or do you take a car? You're going to get to the same destination, but what's the right form of travel? For here, it's what's the right form of healthcare, the delivery model. And so telehealth is not going to be appropriate for everything. Obviously, the one limitation, you can't put hands on a patient. So you can't manipulate for like physical therapy and move things around. You can't feel glands or swollen muscles over telehealth, obviously. But there's a lot you can do, and some things you can even do better potentially. So those are the things we really focus on. Not necessarily that telehealth is different, but it's just an optional delivery mechanism for providers. And of course, an optional stream of revenue as well. Growing access to patients, being able to keep patients. You think if a student grew up in Little Rock and they moved to Fayetteville, well, they may lose their primary care provider, but if they're still able to telehealth into that provider, then they still keep their family doctor that they had who knows them and has their record versus having to transfer that, and vice versa. The whole world becomes a potential patient population. So it's really advantageous both for the provider as well as the patient.
What are challenges that you see with it, though?
Well, certainly broadband is one of those, and it's getting so much better. The federal government as well as state governments have invested millions and even billions of dollars in broadband infrastructure throughout the country, including Arkansas and surrounding states. And so it's getting much better. Cellular's great. Satellite, Starlink is one that people in critically rural areas are using right now. And of course, all of your fiber providers, and it's getting so much better. And so even though there are places that is very hard to get quality broadband, it's significantly better than it was even a few years ago. But access through the broadband capability is certainly one of those limitations. And then just understanding what it is, the basic health literacy that we all talk about in rural, understanding that you can talk to someone over the phone and that quality of care is the same as it would be in person, the same providers, keeping up with everything in a secure way and being able to treat you as best as he or her can as a provider. Just understanding that from a patient side is still a challenge.
Have you seen a significant change in how that affects rural or underserved populations with telehealth? Has it been a game changer? It's particularly within the states that you serve.
Yeah, well, absolutely. Anytime you can grow access, it's a good thing. I used to say, especially through all the workforce challenges that we've had since the pandemic, some care is better than no care, and some places have had no care. So anything we can do to grow access in a vulnerable population is a good thing. Is it the best care that someone can get in every single form of telehealth? Maybe not, but it is access where access may not have existed, and that in itself, for me, is a positive. But certainly, we want medical providers to do what they know is best for their patients, and if it's not appropriate, we don't want them to use telehealth. We want those patients in person, but we also want providers to expand the reach of what telehealth can do reasonably and effectively for those patients, and of course, for the patients to have access to it. But we've seen the needle move. Access has grown in areas where there was no access. There was very little access. And especially with the concerns over our hospitals and our clinics and the sustainability of those in our rural areas, we need some form of access. And if a hospital closes, we absolutely have to have some form of healthcare for those patients in a reasonable way. And telehealth, obviously, it's not going to be an emergency room, but it is a doctor or a nurse on the other line that can help triage you and carry you to the right place or guide you to the right place. And that in itself is very helpful.
Very helpful. And is Arkansas, what does it look like compared to other, say, border states, those that you're in?
So all the states around Arkansas are about the same. There's some nuances to Medicaid, and the licensure is pretty much the same in all. You have to have a state license to provide telehealth in that state. So in Arkansas, you have to be a licensed provider in Arkansas to deliver telehealth to an Arkansas patient. That's effective or needed because if you are in Missouri, if you're in Texas, and you are providing telehealth to a patient in Arkansas, but you're not a licensed provider in Arkansas, now you're breaking the law. That's one of those things. And honestly, I wish our state licensure collaboratives would allow a greater flexibility. That's just my personal wish. And I think we'll get there. But there's still the concern that we want to make sure licensed providers are delivering it to patients in the state. Mississippi, Tennessee, Arkansas, Missouri, Texas are all the exact same. You have to have a license in that state. Even though they're in the same compact, you still have to have that license. But the ability to deliver telehealth anytime, anywhere to any patient is effectively the same in all of those states now, which is great.
And what role does telehealth play in managing chronic conditions or like providing ongoing care for patients with long-term health issues?
So this is actually one of my favorite things about telehealth and telemedicine. There's been some research and one out of Ruleville, Mississippi, North Sunflower Medical Center back it may have been 10, 12 years ago now, did a pilot with the federal government on remote patient monitoring, which no one knew what that was back then. But that's using telehealth technology in someone's home. You have a check-in every day. You're taking your vitals, your blood pressure, heart rate, body mass index, and in some cases A1C and other vitals. And those are uploaded through an iPad or a tablet, I think it was back then. I'm not sure if it was an iPad originally. Goes into a repository where nurse practitioners or other providers are sitting there watching an entire monitor of data coming through, and it'll flag it, green, yellow, red, depending on what the measurables are. And they see red pop up, then they pick up the phone, they call Miss Smith. Miss Smith, we see that your blood pressure's up today. Did you have too much salt? Did you hit the buffet? What happened today? Yeah, I had a bad day and I had a little extra, little extra fried chicken. Oh, that's no problem. But, let's make sure we control it over the long term. Make sure you get your steps in, drink plenty of water. And so what that does is instead of creating a chronic issue to exacerbate over time, now that patient's getting immediate consultation and help to get the blood pressure down, make sure they don't have to increase medication, which we don't want. After that original study, most of those patients were diabetic and hypertensive. Most of them came off of, in fact, they were all diabetic. Most were hypertensive. Almost all became non-hypertensive through minimal medication. And about 3/4 of them were no longer diabetic at the end because their pancreas was still able to provide some insulin, but their glucose levels were so off that they had to take insulin. They were able to come off. Fantastic results. And since then, we've seen RPM, remote patient monitoring, do this for so many patients. So not only excellent for patient health and longevity of their lives, but think taxpayer dollars. If we can keep someone from being on insulin and keep them healthy and working longer and having less chronic issues throughout their life, then you're saving literally billions of dollars of Medicare funds and millions of Medicaid funds just for pennies on the dollar, or even fractions of pennies on the dollar of investment in health through RPM and then chronic care management, which is the other one. It's kind of a lesser form, but still very effective for treating patients with chronic illnesses.
So we're hearing a lot about AI in healthcare. How do you see advancements in AI or machine learning that might shape the future of telehealth and enhance patient care?
it's really interesting seeing the development of AI. And for some who I say the uninitiated, you see AI and you think the Terminator, or you think, one of these movies. Now, I'm not saying that this isn't going to happen one day. God forbid. I hope we don't. Let's just not give it the launch codes to nuclear weapons and we should be okay. But AI is simply an extraordinarily complex set of algorithms that can come up with likely results. So if you use ChatGPT or one of these other platforms for AI, all it's doing is you enter a question or a statement or whatever, and it's going to use algorithms based on likely results you're looking for, and it's going to scour the trillions of data points that it has, mostly internet-based, and it's going to then take that information, put it into learned languages, and then give you an answer back. It's fascinating how it works, but understanding how it works kind of helps take the scariness out of it. It's not literally a self-thinking machine. It's just simply a very complex set of algorithms that comes up with answers based on human data. And so it's never going to get up and start walking around, I don't think. But for the sake of augmenting what we do, I think it is a great augmentation tool. I don't think it'll ever replace humans in any instance, but it will augment what our doctors and our nurses do in the clinical practice. So if you're treating a patient, instead of being facing away from someone, typing notes into a computer, you can have a dialogue one-on-one, never touch a computer. The machine learning will listen to our voices and even our Southern accents now. It's gotten better at listening to us. It will then type it all in as a transcript, and it's remarkably accurate. It'll even correct the transcript based on what likely was the conversation. It'll then transcribe that into either SOAP notes or likely billing codes. And then all you do is after the patient encounter, you check out everything, make sure everything's clicked, hit submit. It goes to the HIM department. They make sure all the billing codes are appropriate for that insurance company, and then they file the claim right there. Significant savings of time and effort, and honestly, an improvement of accuracy as well. Because if you're hand typing things, you're going to mistype, you're going to use short code that's not everyone may know. So it's really improving the patient interaction, and it's helping to augment what that doctor or nurse is doing there in the clinic or whatever provider it is. It's really amazing.
So amazing. How receptive is the healthcare community to that?
I think those that see it and use it realize the power it has. I mean, I was a skeptic at first too, and I'm starting to use AI a bit now, and I'm starting to realize, okay, this is really impressive. It's really amazing. But I think a healthy fear of anything is not a bad thing, as long as, and people had a healthy fear of telehealth for a while too. Oh my gosh, telehealth is going to take away all my patients, and some doctor in New York is going to steal all my patients. I'm never going to have them. No one from Arkansas wants to go see a doctor in New York most of the time. They want to see their doctor that they know, someone local. That doesn't mean that telehealth isn't the better modality to go see them. It just means that might grow the access to someone they already wanted to go see anyway. Now, yes, there is opportunity for other providers across the country or across the world to potentially see someone, especially if a specialist or anyone who can really dive in deeper than maybe someone could here. And I don't have an example, but there's probably some. But AI like telehealth just helps us to augment what we have, grow the opportunity, grow the access, and ultimately, hopefully, make our lives easier.
Mm. And how do you see telehealth influencing healthcare costs in the future? Do you anticipate a middle ground with insurance companies and how all of that works?
That's an interesting question.
Okay.
And that's a complicated answer that I'll try to, I'm going to dive in a couple of streamlines for you, but we could spend all day on that. So one issue I have with the federal government, and it's probably the only one for this, is the Office of Management and Budget, the OMB, scores telehealth as a cost plus to the federal budget. I don't see how they get that number. But beyond, if they look beyond the length of their nose, they're going to see telehealth as a cost savings. Every data point that we have shows that telehealth is a cost savings. Yes, we might have more encounters, possibly, because it's growing access. But that access in every metric is helping to save us money because it's keeping people healthier. So the OMB scores telehealth as a cost plus, meaning Medicare, they think Medicare the budget will increase because of telehealth. This is why our permanency in the expansion of telehealth pandemic provisions is still kind of stalled on the federal side. We're kind of kicking the can down the road with the continuing resolution in December, and there's another one that will come up soon in March, I'm sure, that will kick it down the road maybe a couple more years. years, hopefully. But the permanent extension is only being held up by the OMB, I believe, falsely scoring it as a cost to Medicare. I believe it's a cost savings, and almost every elected official I talk to sees the same thing. So that's one element. From the insurer standpoint, I think almost every insurance company realizes that telehealth is a good thing. It's saving them money. It's keeping patients healthier. All the things I said earlier. It's helping to make sure that cost stays down and patients are healthy, and that's good for everybody. Doctors like that. Insurance companies like that. Elected officials like that. Everyone wants people to be healthy, and there's more incentives now to keep people healthy, which is also a good thing. Which is why I mentioned remote patient monitoring, chronic care management. The incentives for those are really good. You could have every patient with a chronic issue in your patient platform on remote patient monitoring or a chronic care management program, and they're getting great services, and you are getting money for providing those services. It's a win-win for everyone. So it's really it's saving money, it's growing access. The state, Medicaid, and of course Medicare is paying for it now and paying better and for more services than they did before. It's still a slow growth in some areas, but we're starting to see more. I mean, even Arkansas now has a bill out for providing veterinary care via telehealth, which is a whole other thing. Honestly, one I've never even considered, but it's great. I love it. I mean, that goes for both people's pets as well as farm animals and anything else. Being able to provide antibiotics via a telehealth encounter, that's great. That's truly growing access and helping so many people in a different way. So I think it's definitely reducing cost and being more efficient in the system, using our resources more wisely. And I'll go and talk about the fraud and abuse side, because that's the term now. There's always going to be fraud. Criminals are going to be criminals regardless of what laws we pass. That's why they're criminals, right? So there's always someone who's going to do something with telehealth. Remarkably, I've seen very little of it in the entire country. And the only thing that I've seen was related to controlled substances. It was very minimal. It was caught very quickly. And I've not really seen overbilling. I haven't seen fraudulent coding. I haven't seen abuse of encounters. Could it happen? Absolutely. We've seen all sorts of scandals through the VA and through Medicare where people will take advantage of the system. But again, criminals are going to be criminals. They're going to do that regardless. If we can make this accessible to everyone and then just go back and punish those who are breaking the law, who are abusing the system and costing taxpayer dollars or dollars for insurance companies, then let's punish those who are doing wrong, but not punish the system for the sake of the fact that some people are just going to be bad regardless.
So in close, what are the resources out there for the healthcare community to learn more about it? Where should they go? What should they do?
Yeah. So we have an excellent resource here in Little Rock. The South Central Telehealth Resource Center, based at UAMS, covers the territory around Arkansas, and they are a fantastic resource for telehealth information. They have education on there. They have a great staff that does a great job at outreach and promotion of telehealth. I'm on their board and their advisory board, and they help us quite a bit with what we do. There's also organizations focused on telehealth in and around Arkansas. I'm a part of one actually in Mississippi as well. And we do a lot of education and training around telehealth and just networking around what telehealth is, peer-to-peer learning. I think that's one of the most effective things. If someone's doing something really cool and innovative in telehealth or telemedicine or really anything in healthcare, but let's just share it and learn from each other. The rising tide rises all boats. So if we're all more effective, then we're all going to be better.
Well, more effective and more better, not only for Arkansas, but for the rest of the country.
That's right. Absolutely.
Well, thank you, Ryan, for being here today. I appreciate it. And that's it for this episode of AFMC TV. Thanks for watching and have a great day.